we talk a lot about in the world of physical therapy and athletic training and like traditional clinical physical rehab. The outcomes are bleak, to be honest. The outcomes are mediocre at best. Like 6 to 7 out of 10 patients maybe get better. And it takes them 8 to 12 weeks, if not longer. That mediocrity, what happens is a lot of patients actually get lost along the way. They just stop going because patients, people in general, like, why would you continue to do something if you're not seeing the results, right? And so they leave their clinical regimented rehab, whether it's with an athletic trainer or whether it's with a physical therapist, and they seek other care. And the care that they often seek is with the chiropractor or they go to Pilates. And you'll hear over and over from those patients of basically stories of, I failed rehab at a physical therapy clinic, or I went to see my athletic trainer and they couldn't help me, or a combination of those two, honestly, for a lot of my athletes. They'll say, but I started doing Pilates and then everything felt better. Or I started going to the chiropractor and I started finally feeling better. Or some other scenarios, I started doing yoga and I started feeling better, depending on the type of yoga. Because some yoga is very much like Pilates in that it emphasizes spinal mobility over everything. And that's the other thing that chiropractors do really well is they emphasize and treat via the spine. And when we start to treat via the spine, we start changing these little micro adhesions throughout the spinal dura, throughout the dentate ligaments, and we allow for improved cerebral spinal flow, decreased tension in the vertebrae, also a viscerosomatic effect to the organs. So sometimes the organs now have improved sympathetic flow to them from changing the input neurally at the spine. So the organs may start functioning better. And then this protective mechanism starts to improve, right? The spine, this somatic reflex loop gets improved. So the tone around the spine changes, which further changes the mechanics and the tension at the dentate ligaments, the tension at the posterior longitudinal ligament of the spine, the tension at the dura, the sensory information at the little sinovertebral nerves. And then this is reflected in a change of tension in the cranium. And when we have a change of tension in the cranium, we start affecting the reticular formation at the brainstem, which automatically is going to change our autonomic nervous system state, which is going to facilitate a more healing response. And when we're in that more parasympathetic response, we're going to be functioning better, feeling better, decreased sensitivity, improved movement,